Oh, brother.
Hi, everyone. Welcome. I'm sorry we had a few technical difficulties. Thank you so much for being patient. As you can see here, Dr. Butterwick and I both have our masks on because today is a very special new webinar made all about beauty above the mask. So she's going to be talking about rejuvenating this area because when we wear masks, sometimes you can't see the beautiful lips and the chiseled jawline. So she's going to be talking about rejuvenation all in this area. Everything from the Botox brow lift to fillers for temples and cheeks to lasers. So while we are getting acclimated here, I just want to thank you all. I see you guys all stayed and waited.
Are you still there, Risa?
Yeah, we're here.
Risa?
Hi, Dr. Butterwick.
Uh-oh. Oh, hi. It cut out for a minute. I just want to make sure we have no more technical difficulties.
Yes, no more. Okay, so we'll get started right away. I know it's getting late. Just so you guys know, as a reminder, the bottom of their screen is a Q&A so that you can pop in questions you have for Dr. Butterwick after her presentation. And otherwise, I am extremely excited to introduce Dr. Butterwick. She is a board-certified dermatologist. She's been with Cosmetic Laser Dermatology for decades, since the beginning. She's incredibly experienced with all types of cosmetic dermatology, from injectables to lasers to body sculpting to veins to just all types of aesthetics and anti-aging. And we are honored today to have her speaking all about beauty above the mask. So with that in mind, Dr. Butterwick, it's all yours.
Thank you very much, Risa. And since I'm all alone in this room, I get to take off my mask. And I know all of you have been wearing masks. It's an important thing to do right now. And we definitely get tired of the mask. Oh, these are some of my disclosures. I have relationships with some of the companies doing research or lecturing for them, but I'll tell you the truth about what I think about everything. So this is us right now. We have to wear these masks and breathe into them, and we get tired of wearing them, but we know we're gonna be in a long haul still, probably till next spring, that we're gonna have to deal with this issue. And how can we look our best while we're dealing with this? I'm finding people coming in and just getting a little bit of treatment makes you feel so much better when you're sort of worn down by everything that's going on in our world today. So even poor Mona Lisa has to wear a mask. But how are we going to look our best? Well, first we have to define what is beautiful. Then we'll talk about what are the signs that make us look bad. And number 3, what causes those problems? And lastly, we'll be talking about how to rejuvenate and enhance beauty of the upper face. So first, let's talk about beauty of the upper face. Here are some popular movie stars, even starting with Audrey Hepburn, but they all have something in common. This, just from the nose up, you can tell they're beautiful women. What's so beautiful about it? Well, look at the skin first. It's clear. You don't see a spot or a broken blood vessel or a patch of melasma anywhere. Look at the muscle tone. They're not frowning and creating the 11s with excessive muscle movement, or have deep crow's feet from lots of movement, or those lines across the forehead. So there's minimal excess muscle movement. Thirdly, the volume or contour is really pretty. The foreheads, the way the cheek goes up towards the eye, the way the nose kind of branches out in almost like a seagull pattern there. So that's part of what's so beautiful about the upper face. That and the fact there's no laxity. The brows aren't hanging down into the eyelids, and we don't see a bunch of loose skin below the eye. So those are the things we don't like to see. We also, when we're looking at a face, we talk about ideal proportions. Technically, the face should be divisible into thirds from the forehead to the area between the brow. We call that the glabella to the base of the nose, and the base of the nose to the chin. That should be a third distance. And we should be 5 eye widths across in the mid face. as we age, we can kind of get more narrow and long, and it's really most beautiful to have that wider mid face that's 5 eye widths across. And there are certain proportions that we look for in the brow. And if you just look up how to use good eyebrow pencil, they'll show you these distinct points where the eyebrow should start and intersect with the corner of the eye and the nose. That should be a straight line. The peak of the eyebrow should be about part way from a line from the nose through the edge of the pupil. And then the tail of the brow should come all the way out and intersect with this line from the nose to the outer corner of the eye and then to the tail of the brow. And many times as we age, the brow starts getting shorter, and so it doesn't come out to its full width. And it's really pretty when it does. So that's something we look for. Now, young faces have beautiful contour, smoothness, projection, but even they can start like Zac Efron there has a few little lines in his forehead. And you'll notice the difference between a male brow tends to be straight and the female brow will be arched. But a lot of times, if you're not a movie star, it's you have some issues. Sometimes there can be deep circles under the eyes, even at a young age, even in your 20s. And if you have problems early on, it's largely genetic, not just aging and sun damage. Now, as you age, the upper face can show signs more of sun damage and other aspects of aging. But with a little bit of help, like these two, they can still look great as they age. As we're older, we don't have to look like we're 20, but you still want to look good at every age. Now here are some signs of aging. This is a nice youthful upper face. And you see some shadowing starting around the eye, the brow starting to drop down. Look at the forehead. In the first picture, it's a kind of an oval on top. It's starting to slant in. And actually our heads get a little bit smaller as we age. And then the skin will kind of fall down and crowd around the eyes. That causes some excess muscle movement. You're starting to get some circles under the eyes. And then lastly, just the whole face starts to kind of cave inward and down, giving the eyes get a little bit more deep set, and the dark circles and all the other things start happening that it's just not great to see. And it not only is not aesthetically pretty, but it does convey an emotion like you're not happy or you're grumpy when you actually feel just fine as you age. So some of these changes are caused, the superficial changes are caused by sun damage, like the brown spots, freckling. Excess sun can cause wrinkling because it damages the collagen and the skins will wrinkle more easily, because especially those UVA rays go deep into the skin. They're the UVA rays go into the dermis, while the UVB rays don't go quite as deep. So both of those rays can damage our skin. The UVA ray is present all day long, just as strong at 7 in the morning, and it's present all year round. And it goes through window glass. So we need to be careful all the time with our sunscreen, even while driving in our cars. And our UV camera can show all this sun damage, all those spots that are lurking there, and they'll come out later in life as we age. But they're there at an early stage. So we say that most of the sun damage that shows up later in life is from the first 18 to 20 years of life. So all you young people listening, be sure to get your sunscreen on early on. So aging is a multi-level process. We see it in the skin first, then in some of the fat pads, in the muscle layer, and also in the bone. The orbital framework changes. Our eye socket gets a little bigger, and the bone gets a little smaller and remodels as we age. So early on in your 20s, there might be a hint of a circle, but it'll get deeper in your 30s, and in your 40s, it'll get a little deeper. Crow's feet will get a little deeper. because we start to lose a teaspoon of fat starting at age 30 from our face. So by the time you're 40, there's more shadowing, more drooping from volume loss as these fat compartments shrink down. There's even fat compartments in the upper eyelid, and when they shrink down, the skin will get loose and you can get wrinkling in the eyelid, or you can just get a hard look because it's nice to have a little pillow under the upper eyelid. Now, this is a picture of people who have aged over time. These are the parents of the author of this article, and you can see if you keep the bone the same, just how the eyes change and the tissue seems to fall away from the eye and cause more. There's more volume loss, more circles. And look at between the eyes. There's a caving in between the eyebrow, and that's from a lot of bone loss. Okay, well, that's kind of depressing, but let's think about ways that we can fix this and actually prevent a lot of this with some early intervention. We talk about the 4 R's when we talk about rejuvenation: relaxing tense muscles, resurfacing sun damage, and this can be gentle or more aggressive depending on the type of aging that we have, refilling, revolumizing, and redraping or trying to tighten the loose skin. So that's what I'll talk about now for the upper face. So botulinum toxin, or we call it Botox, is the #1 cosmetic treatment in the United States, and there's a reason for that. It works really well, as you can see in this patient. But there's several types of botulinum toxin. They're all actually quite good and similar, but slightly different. So we try to choose the one that we think will work best in you, and sometimes there's a special on one, so we'll use that one. So there's Botox, Dysport, Xeomin, and the newest one is Jeuveau, and there's more to come. We'll be seeing one that will potentially last even longer from the Revance company. Now, it's not that simple doing Botox. We examine everything about the eye when you come in. We look at the brow position. We see if one side has more activity than the other. We see if one of the eyelids is kind of more droopy, if there's asymmetry. How big the muscle is tells us how much we might want to use. And different patient preferences. Some people want their eyebrows up, some like them flatter. We want the difference between males and females to show, not make a feminine brow in a male. That doesn't look good. And these are the muscles that we're usually treating. There's the one between the brow called the procerus. The corrugator's on the side. I don't know if you can see me, but the corrugator pulls the 11s together. And the frontalis is the big muscle of the forehead. When it wrinkles, when it contracts, it makes the horizontal wrinkles. But it does hold our brow up, so we want to be careful when we're doing Botox, not to lower the brow, not to put too much in that frontalis muscle, or you'll feel your brow is much too heavy, or you won't be able to raise it. We don't really like the frozen look with Botox. It looks too artificial, although some people like it, and we can do it if you like it. And then there's the muscle around the eye called the orbicularis that we use for treating the crow's feet. So this patient's trying to frown in the second picture, and she can't, but the whole forehead will look smoother and more natural when that's treated. If the lines or the 11 wrinkles there are deeper, you can see you can make them almost go away. But what we find over time, this patient, the first time that fine line might not go away completely, but once you do it a couple more times, those lines can completely disappear. So it's nice if you start young, you can actually prevent these from ever occurring. So we're finding more and more the millennial age group is coming in to just get a little bit of Botox or Dysport or Xeomin much less often to prevent that from ever happening. So they'll age more slowly than prior generations. And in the forehead, we want to make it smooth. This patient had a nice smoothing of her forehead. Looks like she went to the beach and got a little bit of suntan. But you see that a few lines didn't quite go away. If you try to get every last line in the forehead, sometimes you can drop the brow too much. So at times, depending on the position of the brow, we have to leave a few lines. And we could always fill that in with a little bit of filler if we wanted to. The crow's feet are a perfect area for Botox treatment, and you see a lot of smoothing in this younger patient. It's nice to be preventative. You'll also see that when she used to smile, in the younger patient on my right, you see a little bulge, muscle bulge under her eye that's softened with the second time. So she had a hyperactive muscle there, and we can soften that, and that can kind of open up the eye as well. There's a lot of details with Botox, whether you have a full fan of crow's feet or just the lower half or just the upper half. So it's nice to go to someone who's very experienced and can tell just exactly where you need it. Now the bunny lines, here I get this, those were to cover the patient's eyes. Those are those little wrinkles by the nose that some people get when they smile, and then they get deeper and deeper. And we just take a little dot of Botox on the transverse portion of the nasalis muscle, and that will soften that particular muscle. Now, there have been studies that show that should we do just the center, the whole forehead, or the crow's feet too, that patients are actually happier, there's a higher patient satisfaction to treat all the areas, and then everything kind of goes together. So that's taken many years off her face just with Botox. It's the simplest treatment, and that's the one cosmetically that most people actually start with. If you've never done anything, just try a little bit of Botox and you'll be happy. This graph just shows that Jeuveau, a new one, lasted just as long when it was compared to Botox at day 150. Botox will last about 3 to 4 months if you're lucky. Maybe you can go a little longer if you're younger. But it always wears off, which is sort of good because our faces do change over time, and what looks good when you're 20 might not look good when you're 50. So we like to, it's not so bad that these things wear off, although it'd be nice if they lasted a little bit longer. But patients come in on average about 3 times a year for this treatment, and we always get lovely benefits. Now, so once we can do some little bit of toxin, and then we want to look at the skin. Sometimes it's just the skin that's bothering you on the forehead, discoloration, texture, wrinkles, drooping, laxity. Now, this patient is an athlete, and she's always outside running, swimming, etc. And she has a type of melasma that results in those dark pigment but little white dots. And the rest of her face was kind of blotchy. So we just did a little bit of intense pulse light plus a very simple light laser called the 1440 Clear and Brilliant. And usually patients do 1 to 3 treatments. There's absolutely no downtime with this. And we got the pigment to be more uniform. She still goes outside, so she's a little bit tan, even though she does wear lots of sunscreen now. But a little color will get through. And so every so often, maybe every 6 months to a year, she'll come in and we'll just do top off to blend the pigment. So IPL, Clear and Brilliant, these are wonderful light laser treatments, no downtime, that will keep your skin clear of blotchiness. This patient had more blotchiness, so she probably had a series 3 IPLs, and combining that with the Botox brow lift, you see some of the muscles pull your brow down, and if we release those, you get a little lift. If you look at her eyelids, they look higher, and she got clearing of her spots with the IPL and a good skincare. So we always emphasize good skincare as well. The Fraxel Dual is one that, if the damage is a little bit more significant, takes about 5 days or so to look normal, but that will clear out lots of brown spots and roughness as well. This patient had a lot of precancers on his forehead and broken blood vessels on the nose, and so he had a treatment called photodynamic therapy. This helps skin cancer and gives a nice healthy tone and texture to the skin and helps broken blood vessels. So if you're having trouble with precancers on the face, or you've ever had a skin cancer on your face, this is a wonderful treatment to do. And I actually had a basal cell skin cancer right on my upper nose a couple years ago. The scar has been lasered, so you can't tell. But afterwards, I did one of these because I never wanted to have this. That's for preventing skin cancer. Now, as time goes by, a lot of women tend to get this crepey skin under the eyes and above the eyes. You can see she's got that heavy upper lid and crinkling. And this is with a fractional CO2, you can get a good tightening with that laser. That takes about a week, maybe 5 to 7 days to heal from. But sometimes the damage is worse, as in this older patient, she has just heavier and a lot more deeper wrinkles. There we do a fully ablative, and this is about a month after, where you see she's still pink. But we can get a lot of tightening around the eyes with a fully ablative laser. Now this patient, you might think, why does she do a laser? Her upper face isn't too bad. So we can do lighter on her upper face, but someday we'll be taking our masks off and you see all the wrinkles on the lower face, and we're able to correct all the wrinkles around her mouth. These patients had more looseness of the eyes, blotchiness. So laser resurfacing will really help this upper face so much. And what we're finding is a lot of patients right now are using the downtime that we have because of COVID. We don't have a lot of social life going on. I know I don't. And so you can kind of hide out a little bit more easily and heal from this type of procedure. This does take 7 to 10 days to heal, depending on how deep it is. And then you'll stay a little pink for about a month. So these do take more downtime, but they can take years of sun damage off and really help a patient to look much younger. This is the full face laser. Now, with lasers, we can also just treat little tiny things. A lot of, wearing a mask, you might now all of a sudden notice that big vein under your eye. And there's a great laser for that, the Cool Touch Varia, or we have a new V-beam laser that can treat this as well. And 1 to 3 treatments with no downtime can cause that vein to shrivel up and disappear without a scar. So that's nice for those deeper blue veins. This was a patient who had a birthmark in that area, and I used the Pico Wave laser to treat. This is called nevus of Ota. She was so happy, it looks like she got extensions, or maybe just good mascara. Or the blotchiness that we see, we can treat that with an Alexandrite laser, the brown spots, or an IPL. Now the next category would be facial fillers, and this does take some skill, especially around the eyes, to choose just the right one, to be thinking what will make the patient look the prettiest. And the areas that we're treating in the upper face are the wrinkles around the eyes and forehead, tear troughs, those circles under the eyes, sometimes the nasal root, because that will sort of cave in. I'll show you that. And then we like to volumize the temples, forehead, and cheeks at times. And we often combine all of this together. So this is a picture of a patient with that deep a line in the center of the forehead. She will need a little bit of filler and Botox. But studies, even back in July 2003, this is an old study, but if you combine Botox with a filler, this happened to be Restylane, you can both act longer. This lasts about 7 or 8 months instead of just 3 or 4 for the Botox. Under the eyes, we do like the tear trough fillers. This is a young woman who shouldn't have aging in her 20s, but I do see this, and that's a largely genetic, just a problem that she's can't help. But we use only certain hyaluronic acid fillers in this area, and the reason is some of them can cause too much volume, water retention, and the eyes will get puffier, which we don't want. We just want to soften the dark circle. So with a properly chosen and well-placed filler, you can really help the dark circle without changing the eye size. It just looks brighter, less tired. I treat a lot of women after they've had their baby and they're not getting much sleep. You can look much more bright-eyed and happy, and this happens also as we age. Now, I've had this under my eyes quite a few times. It tends to last longer and longer as time goes by. So the first time it might last 8 or 9 months, and now the last time I had any under my eyes was probably close to 2 years ago. So it will really start to linger in this area. It's nice. So the tear troughs are a great area to do, men and women. Just take that tired look away. We have to be careful not to overfill. So I often will do one session and have you come back a couple months later, and we might add a little bit more. The lymphatics are tricky under the eye, and so we don't want to put too much and cause you to have puffy eyes. The good news is whatever filler we put under there, we can always use a hyaluronic acid filler that can be dissolved if there's any little lump or bump, and occasionally we do need to do that. The muscle will curl it up into a ball, but that's very rare and we can fix it. So this is a safe, good treatment with the right filler and the right technique. Now, the nasal root is something you might not have thought about, but some people will have kind of a deep groove in between, right at the top of the nose. And it will make it look like the rest of the nose is kind of bumpy. So we can straighten the nose and get a pretty smooth curvature between the brows with well-placed filler. This has to be done by someone very experienced who knows the anatomy to treat this area. It's a little tricky, but it really makes the nose look better and the eyes look better. And so that's a wonderful area. And lastly, I know our cheeks aren't showing much above the mask, but the cheekbone area is showing, and that's a very important area, especially to a woman's beauty. The cheekbone should technically be a little ovoid shaped, a little angled like the picture shows, and it should come up all the way to the lash line and all the way over. As we age, you sort of lose the cheekbone, and the rest of the face will kind of fall down because of this. Now, this patient might come in and say, well, I've got this big blob right by my nose. They might complain of excess skin by the nose, but the real problem is loss of volume around the eye. That fat pad needs to be filled in. It's not the thick place of the nose, it's that fat pad. So if we know the fat compartments and know where to put filler, you can really get beautiful rejuvenation of the eye area. And that happens to be called the SOOF. So when we're seeing only part of the cheek, just popping it a little bit can be so pretty and add just beauty to a woman's face. We also like to treat the temples because that will lift up the cheek and it will help to, we call it ovalizing the face, give the face a beautiful oval or heart-shaped forehead, and the rest of the face will also have a better shape when we do the temples and the cheeks. You see a lot of improvement. She just looks prettier by framing the eyes with filler. And so this happens to also lift the lower face when we place filler in the upper face. Her face looks a little full to begin with, but as we add some filler, it actually looks thinner and prettier. So that's a nice trick with fillers. And again, we can use different hyaluronic acid fillers, and sometimes we use Sculptra to really help this area. Here's another one with temples. We fill those fat pads and make a smoother temple, which actually helps the whole forehead to look better and lifts that brow on the side. Now, lastly, we like to redrape loose skin. by lifting the brow and the eyelids. When we get tired, and I have to admit I've been a little tired and a little at times just dealing with all the things that we need to deal with, you can just feel like everything's sort of falling and your brow is falling. We can lift it to some degree with the Botox, but not as much as we want to at other times. So we use things like energy devices such as Ultherapy and Thermage or other devices that have radio frequency in them. We can lift sometimes with threads. I like the Silhouette Insta-Lift for the cheeks. Or, of course, you could have a facelift, but they usually don't do the brow lift as much as they used to. So I think these other things work quite well. Ulthera works with microfocused ultrasound energy, just little tiny dots of energy that can penetrate down through the fat to the fascia. So I like to do this just above the brow. Sometimes that's all we do. And the day we came back after being closed, I did my full face Ulthera just to tighten the face. And I do that every 2 or 3 years to the right depths. So you can really lift the brow and tighten the tissues. And why do this versus a laser? I think for the forehead, we get better tightening with an Ulthera, and there's no downtime. So you don't need to stay home and heal with this one. Thermage is actually really good. They've got this eye tip, and we can put a protective contact in and treat the entire eyelid, upper and lower. You see that loose skin on the eyelid tightened up to quite a degree. So this can be used on the upper and lower eyelids without any downtime, which is nice. And it can help slow down the aging. This is a patient I did the Silhouette Insta-Lift, and by raising the cheek up, I put a couple sutures in her upper from her nasal labial fold up to the temple area. It raised the whole cheek up, and it pushes volume towards the eye, gives that beautiful cheek volume that we like, and makes the whole face look lifted with just the Insta-Lift. And lastly, I'm going to just mention, let's not forget easier steps that can help our upper face look better. I've been pretty religious with my Latisse for my eyelash growth. And during this time, it seems like I have a little more time at home. So I've been using it 5 nights a week, and it does make your lashes grow longer, thicker, darker. So that looks nice. Don't forget to use makeup and use the tips that you can find on the internet for drawing in just the nice brow with a little bit of arch that extends out along that line I showed you earlier. Sunscreen and good skincare is very important. I have here, I brought in the room, but I don't know if you can see, but one of our best sellers is a new one, Skin Medica Insta Bright, that helps for puffiness and dark circles. I like the Color Science Total Eye Restore Kit. I don't know if you can see me, but that's this whole kit, and they come with these masks for your lower eyelid area. You put that on for 10 minutes and take it off, and all the wrinkles are gone. And for Zoom calls like this one, it's helpful. And I have the camera up a little bit and some lighting right on my face. You don't want side lighting. You want the light right on your face. So sometimes I look at myself on Zoom call and I'm like, I look horrible, but that helps a little bit. So don't forget about that. So thank you for listening. And if you have any questions, you can let me know now. And I also wanted to say to stay healthy now, be sure to hug your loved ones. I know my little puppy has been one of my best companions during this time. So thank you. Risa, are there any questions?
Great. Thank you so much, Dr. Butterwick. And thank you so much again for everyone that tuned in. We do have some questions for you already, but for anyone that wasn't aware, that didn't hear the beginning, at the bottom is a little Q&A. You can go and pop in any questions you have right now to ask for Dr. Butterwick, and she will do her best to answer as many as possible. All right, here is the first question from Marissa. Can you use Botox under the eyes to prevent fine lines when smiling, Or would it be better to use filler under the eyes and then Botox just for the crow's feet and inner nose?
Well, that's an excellent question, Marissa. And it's actually a balance of the two. And if you're young and the tone is good enough, I think that Botox can help quite a bit under the eye. And I will often circle it right around almost to the point of the pupil. So it will help that skin look smoother. Now, if you're a little older and you do that, you can actually make it look much worse. And sometimes if you just do out on the outer crow's feet, it pushes all the lines inside. So every patient is a little bit different. When we examine a patient, we look to see if there is volume loss. And there's something called the medial and lateral soot. These are little fat pads near the eye, and sometimes they need to be filled in to help the skin from crinkling in that area that's kind of like a little well, a little empty space. So when you see someone and there's a lot of wrinkles in one place, there's probably volume loss right under that. Sort of like a balloon. If there's not much air in a balloon, there's more wrinkles. So the answer to your question is sometimes. Sometimes just Botox works. Sometimes we need to add a little filler. Occasionally Botox can make them look worse, and we really have to go to laser or a Thermage or Ulthera to tighten that skin. The eye is tricky, and it often needs a multi-layered approach, Botox, fillers, and some sort of tightening.
Great, really helpful. Okay, I'm gonna, if you don't mind, I'm gonna turn off your presentation so everyone can see you a little bigger now. So, all right, lots more questions coming in. So the first one is, what lasers should olive skin stay away from?
Well, it depends on how olive you are. So, and what your tendency is in the sun. If you tend to pigment when you get any sort of injury, like even acne, if you get really dark. So we ask you a lot of questions to determine. With that said, sometimes we can use a CO2 even on olive skin types, but you have to be very careful, and you have to be careful with even an intense pulse light. One laser that I can say is always quite safe, two of them actually, is the Clear and Brilliant laser. It's called the Clear and Brilliant Permea. I use that a lot of times on darker skin types when we're just trying to even the tone, if you have that melasma, that blotchiness. And then we've got the new picosecond lasers that are quite safe in darker skin types. So it's nice to go to a practice like ours because we have 50 different lasers, and we can make sure we use the one that won't cause problems. If you do have pigment in your skin, you are at risk for turning brown if the laser is too strong or isn't just right for you. So in general, though, to answer your question, picosecond and Clear and Brilliant are very, very safe, but we can go all the way to the strongest laser, the CO2 fully ablative laser, sometimes. If we're very careful and we watch your skin carefully and we just get you through a time of pigmenting a little bit.
Great. Okay, so I think this question is probably a similar answer, but someone else said, can you do laser resurfacing in Asians?
That's tricky, and we have to kind of see you and see what we would want to do. Often the Asian skin is a little thicker and it tends to age a little bit less. And if it's around the eye, the thermage can be very, very good in that area. We might have to do 2 thermages about 3 to 6 months apart to boost it all the way. But I have done CO2 laser in Asians, and so sometimes we do use that. We did a study with Dr. Fitzpatrick a number of years ago on all our patients that had undergone laser resurfacing. And we used it in some very dark skin types, and we followed those patients, many of whom did pigment for a couple months after the laser. then what we do is use good skincare. We use makeup to hide the pigment, and we know it will always go away. So in the study, all the patients, the skin returned to normal. In some of them, if they were really dark, it took months and months. So if you're willing to go through that risk, we can oftentimes laser the darker skin types.
Okay, great. All right, so this one's from Jenny. She says, I'm 56. I've had Fraxel and CO2 in the past. Fitzpatrick skin type 2, and I wear a lot of sunscreen. I have crow's feet that go into my cheeks. Could lasers help that? Because when I've gotten Botox and Dysport, it hasn't helped much, even at CL Derm.
Yeah, I know what you mean. That's a good question. And sometimes the wrinkles just go straight, they go straight down and go all the way down the cheeks and almost connect. When you have that type of situation, Botox can treat some of it, but not all. Because with Botox, if we put it too low, it will affect your smile. So there's a reason that we don't extend our treatment further with Botox. So there, the CO2 fully ablative is pretty much what you need. The other lasers tend to be a little disappointing. So no one is really disappointed with the CO2 because that's as strong as you can do, and it will always tighten at least 50%. You'll want to maintain your results with Botox to prevent that from getting just recurring too soon. And you may also need some volumizing of your cheeks and those fat pads. We call it the medial and lateral SOOF fat pads, subovicularis or oculi fat pads, to reinflate that area so that the skin is stretched out and doesn't fall into wrinkles like that empty balloon analogy I was talking about. So you will need combination therapy and a little bit of maintenance. Usually, when you do the strong CO2, it lasts a nice long time, at least 5 years, oftentimes 10 years, if we do some of these ancillary treatments at the same time. I had one about 20 years ago, and I was thinking of doing another one. We'll see.
Great. So this is an easy one. Cindy says, can you just repeat the 2 products that you mentioned at the end? And I can type them out as well.
Oh, yes. The first one, oh, can you see me now?
We can see
This
you.
is the Skin Medica Instant Bright. And this one is a newer one, and it's for puffiness and dark circles. So this is a nice one. And then this one I like quite a bit. The color science is called the Total Eye Restore Regimen. Let me see if I can open it. Oh, well, might be too tricky, but it's got a kind of a roll-on eye solution to use at night that's anti-aging, and in the morning it has another one in there that camouflages dark circles, treats discoloration, and is a sunscreen. So it's kind of a 3-in-1 treatment that patients really like because it does hide dark circles. So that's a nice one, and then it comes with the eye mask that when I used to go out and go to a party every now and then, I would wear them for 10 minutes and then take it off, and the eyes just look great for that night. So that's sort of a fun cosmetic treatment.
Okay, great. Here's an interesting one. I was worried, are you worried about filler migration? Is this something we should worry about?
A filler migration is possible in the tear trough. In other areas, it hardly ever happens. I had one patient get a massage too soon and it pushed it a little bit. You don't want to push on a filler for a couple days with anything real hard like a massage. But under the eye, there is a phenomenon where occasionally, and we think it's from a combination of the lymphatic drainage in that area and the circular muscle movement of the orbicularis muscle, just creates a situation so it sort of can squeeze a little filler towards the surface. So I've said to patients, after I treat under the eye, it could be 4 or 6 months later, if you see a little bump that or a little bit of shininess, that may be a tiny bit of the filler migrated, and we can just dissolve that tiny little bit. So we worry about it, but not too much because we can deal with it. If you use the wrong filler in that area, there can be a lot of trouble with the migration. So we want to make sure to use the hyaluronic acid fillers that don't bind very much water.
Okay, so the woman, Jenny, that you answered, she said, thanks, I last had Fraxel CO2 5 years ago and ablative CO2 20 years ago, so sounds like I need it again.
Yeah, probably so. Yeah, because on those pictures I showed, the eyes just open up. It just can so tighten the upper lid, and so it's exciting what you get around the eye with a CO2 laser, for sure.
And the technology that's improved a lot since 20 years, of course.
Yeah, definitely so. The technology, the healing, and we use a combination. Usually with the CO2, we treat as we need to, and then we take the erbium laser to actually make it heal faster. We go over it, and that helps you get through that redness phase faster.
Okay, this is an interesting one. Do you do fillers in the nasal bridge region? A few dermatologists have been reluctant to do this for me in the past.
Well, that's what I said. You have to be very careful and go to someone very experienced. Yes, I showed you that picture of the patient I did on this nasal root area. The risk is that the blood vessels in the nose can connect with the blood vessels around the eye. And we have to be very, very, very careful not to get into those blood vessels. So some people feel more comfortable treating the other parts of the face, but that is one of the a higher risk area. And so with very, very careful technique, and I actually, when I'm doing it, I do a technique that blocks those blood vessels. So there would not be a chance of getting into them, but it's not every dermatologist or every plastic surgeon wants to take on that area because it does take a lot of experience, a lot of knowledge of anatomy, which I've studied for many, many years.
Great. All right. Well, I know it's 6 p.m. and everyone needs to head off to dinner or the rest of our evening. So I wanted to just ask one more little of my own questions real fast. Dr. Butterwick, when we're wearing a mask, do we still need to wear sunscreen under the mask?
Well, you mean below the mask? Yes, I would think so because it doesn't cover the sides, and that's where you're driving. You might be getting a lot of sun over there, and you're going to take your mask off periodically. When you're driving, I usually take my mask off because no one's in the car with me. But I think it's a good habit. It's such a great habit to wear sunscreen every single morning. And it's a lot of them are tinted, they're like makeup, so that we should all do that all the time. When I exercise and I'm out in the heat running, I don't like to wear a mask, so I try to cross the street. If I'm getting close to someone, I'll always have sunscreen on. But if I'm walking and I see someone coming towards me, I put the mask back on. So yeah, you take your mask on and off as needed. It's nice to take it off when you can and get some nice deep breaths. So definitely always wear sunscreen. Always, always.
Thought some people might be thinking that I was. All right. Well, thank you so much, Dr. Butterwick. I hope this was really helpful for you guys just to learn how to rejuvenate this whole area above the mask. Dr. Butterwick is available for complimentary one-on-one consultations at our office, and we are open in San Diego with very strict COVID guidelines, so everyone should feel very safe and confident coming if you'd like. If not, we are still offering virtual consults. But otherwise, I hope you enjoyed this and you learned a lot. And you will get a little survey when we close this down. We'd love your feedback. And if not, I just appreciate you guys spending time with us. And I really thank Dr. Butterwick for sharing so much knowledge.
Thank you so much, Risa, and thank you to all of you for listening in, and have a good evening.
Bye.
Bye.